Hello, Suzanne Connors-Ing from Dawn Visions Hypnosis. Today I would like to speak to the concept of whether or not you have a treatment plan that actually helps your patients heal, or if you're merely managing symptoms. Because this is the thing. I know that those of you who have been trained in conventional mental health therapy were taught that so many of the mental illnesses listed in the DSM are to be merely managed. Healing is not even in the paradigm, sadly enough. And yet I can tell you that over 20 plus years of working in hypnotism and neuro-linguistic programming, that my clients, for the past, 19 years now, have proven that many of these diagnoses can indeed be overcome, including anorexia, bulimia, sex addiction, drug addiction, anxiety, and depression. The difference is that you need to know which part of the brain to be working in. And your training did not teach you how to do anything in hypnosis. And some of you might have taken a weekend of hypnotism, but I can tell you this. I spent the better part of 7 years to gain my training. And I'm always learning more, because other professionals do. You consistently and constantly learn more about your profession. But not only do I do that, I also have a background in physical health care. I did, 2/3 of a nursing degree, and then I dropped out because I didn't like it. But I learned a lot of very important information in terms of how the allopathic medical model works, and apply the information I learned there to the work I do with my clients, as well as close to 10 years working in conventional mental health as a non-licensed counselor in supported housing programs where my clients were over-medicated and demeaned for having the problems that they were there to be supported with. Pretty disgusting, actually. Which is why I sought to go into nursing school, thinking becoming a psych nurse might be a better way to go, but I didn't like the nursing instructors that I had. They were very mean, nasty people, even to the patients while we were doing clinical. That was actually what pushed me over the edge, that I knew I didn't want to be an angry person like that, so I dropped out. And I found my way into hypnotism and neuro-linguistic programming because we believe that we're there to help our clients to reach their own objectives, and that they have a way to actually know that they met their objectives for the treatment, as well as being able to help them clear the problems that they're dealing with. Now, it does not work with people with psychotic features, nor does it work for people who are legitimately given personality disorder diagnoses. Pretty much anybody else it works very well with after 20 plus years of doing this work. So if you're interested in actually learning how to do hypnotism and neuro-linguistic programming and receiving a 12-month mentorship along with the program, which is something I do not know is being offered by anybody else who does either hypnosis training or neuro-linguistic programming training these days. I was lucky enough to have that included with my practitioner in NLP program and my master practitioner in NLP program. So I was calling Hawaii from Boston practically every week to get guidance on how to best help my clients until I learned how to do what I learned how to do quite proficiently. And I would imagine that you would really agree that that's the best way to learn, because you did have to do a clinical to get your license to practice mental health therapy, didn't you? With supervision and oversight and guidance. If you're interested in learning more about that program, which is really fun, and my trainees really love it, you will be able to get my contact information so we can schedule a consultation call to see if that's something that you'd like to actually do. Well, that's all I have for this particular video. So, as always, I thank you for spending your time with me. Until next time, bye-bye all.